In this presentation, we'll explore a real hospital scenario involving a discharge decision and apply APA ethical standards to analyze the case. Here's our scenario. Dr. Patel is asked to assess a patient for discharge. Although medically stable, the patient still shows unstable mental status. Hospital staff are pushing for discharge due to bed availability pressures. So what ethical standards are at play? For this specific scenario, we think that there are 4 big standards that are at play. Standard 2. Standard 2 states that psychologists should provide services, teach, and conduct research with populations and in areas only within the boundaries of their competence. If Dr. Patel lacks the confidence or data to confirm mental readiness, moving forward under pressure could violate this standard. Standard 3. Standard 3 claims that psychologists should avoid harming their clients and minimize harm where it is foreseeable and unavoidable. If Dr. Patel suspects that harm could come from an early discharge, this concern must outweigh external pressures from the medical team. Standard 4. Standard 4 claims psychologists should have a primary obligation to protect confidential information obtained through or stored in any medium. If discussing the patient's case with medical staff, Standard 4 reminds us that even in hospital settings, confidentiality of the patient must be protected within the ethical bounds. Standard 10. Standard 10 says psychologists should terminate therapy when it becomes reasonably clear that the client no longer needs the service, is not likely to benefit, or is being harmed. If Dr. Patel must discharge, it should include a clear follow-up plan to protect the patient's safety and mental health after leaving the hospital. So we have 2 competing pressures with this case: the institutional and hospital pressure, and the clinical judgment and ethical concern. These 2 forces often conflict. The hospital needs beds, while the psychologist needs time to ensure that the patient is safe for discharge. This disconnect is where ethical dilemmas happen. So what are the ethical risks? Acting too fast could lead to serious issues. First, it risks violating competence by acting beyond clinical judgment. Second, a premature discharge can cause harm, violating both human relations and therapy standards. And third, incomplete planning for follow-up could harm the patient further by not giving him a safety net to fall back on. So what is our recommended response here? The best practice here involves clear documentation of clinical findings and concerns, seeking ethical consultation, and recommending a brief delay with outpatient follow-up. This ensures that we are honoring clinical judgment and patient well-being. Now, I'd like you to reflect. What would you do if you were in Dr. Patel's position? How would you balance loyalty to your patient with hospital demands? And now to wrap up. Always let ethical standards guide your practice, especially under pressure. Document thoroughly, consult your team, and advocate for your client welfare as priority. Great work working through this case. Next up, we have a 7-question quiz to test your understanding of the ethical standards discussed in this section. Good luck.